Well, experts say the pandemic is taking a great toll on our frontline workers. Healthcare workers are empathetic people by nature.
But as News 8 Now's Isabella Hulsizer tells us new at 10 tonight, they are being impacted by mental health issues.
Calls for mental health crisis and mental health situations has risen drastically.
And as COVID-19 numbers climb,
workers are under tremendous amount of stress right now, given the volumes of patients that need care.
During the pandemic, experts have seen two types of trauma develop prevalently within healthcare workers.
One is called vicarious trauma. The other is a secondary trauma.
Working with humans are coming into contact with all of the pieces of that human, which may include trauma. And if you are someone who cares about other people, that trauma inevitably is going to impact you as well.
In healthcare, generally people are very caring, and so we need to be aware of what's called empathy fatigue.
Health officials say these frontline workers are carrying that emotional burden home, and they need help finding ways to cope.
Just even talk to someone to get some connectedness, social connectedness, and just to get some support.
If you are a healthcare worker and you're finding that your energy is low, or you're struggling, or you're feeling like you're supposed to be on 100% of the time, that is just not reasonable.
Johnson says our region has plenty of resources for people to get help, but the first step is asking for it.
Asking for help is way harder in our minds than it is in reality, most of the time.
Some local resources available for those struggling include the Great Rivers 211 hotline, the Tellurian Center, and YMCA's Better Together Dinner Table Resilience Program. In La-Crosse, Isabella Hulsizer, News 8 Now.
And both local health systems do have programs in place for staff that's experiencing a mental health crisis.
And again, health officials want to remind people that resources, as Isabella mentioned, like 211 and the Better Together program, are also available to non-healthcare workers.